Shalom, this is Yoshua Oliver coming to you on the 15th of May 2020. And I'm just flabbergasted. You know, I knew things were going to get bad. I didn't realize it would happen so quickly. I didn't realize how real it would be. I guess if that makes sense. I mean, the latest news is just horrific. It's it's just terrible, terrible, unbelievable developments going on that it's just so weird, it's bizarre, it's surreal, it's insane how all those people who believe the government story aren't waking up. They're still in such incredible denial. They still they still think there's some kind of real epidemic and there's some real um, health issue going on. It's just it's like it's like I'm watching 9/11 happen. You know, I'm watching such a perverse mind control operation take place before my eyes, and I want to scream at all these people, and I want to. It's just unbelievable. What does this contact tracing really mean? I mean, it's even worse than whatever you thought. It's even worse than that. The more you research it, the more your hair stands on end. The more the more you want to think, where can I run to? Where can I run to? I'm from Australia. Should I go back to Australia? Or maybe no, Australia is even worse than America. So I can't go to Australia. And, in theory, or of return, I could go to the state of Israel. But no, I can't go to the state of Israel because that's even worse than Australia and America. So where could I go with my family to? Um, I don't know, but where else would I have a reason to go somewhere to get away from this insanity? There's nowhere to go. It's just you want to simply escape. You want to escape, and there's nowhere to escape to. Maybe to Mexico. We've been discussing for all this time how all the Mexicans want to come to the United States. These illegal uh, immigrants, and that's such a bad thing for the country. Well, if there'll be a way to immigrate to illegally to leave America, I would think that would be the most sane thing to do at this time. Like, if you were thinking clearly, you would want to run to Mexico or Argentina or somewhere where they don't have anywhere near this level of government um, power grab, of insane deprivation of people's rights. They've just got the usual mafia running the show, but not this degree of evil. So I don't know. Maybe I should try to figure out how I can flee with my family to Mexico and live illegally there or something. I don't know. I just don't know. Just, it's just overwhelming. It's personally overwhelming to read these and listen to these chilling reports. Seattle Times. Washington has nearly 1,400 trained contact tracing personnel who are beginning to contact each new person. They've already started. The law has already been passed. It's already started. It's not theoretical. It's already been passed by both sides. Um, right. Washington, okay, Governor Jay Inslee. This guy, this governor is his speech that he gave about contact tracing is just terrifying. It's the most scary thing I've heard. That, that I can't remember hearing anything as scary as this from a politician, and I just can't remember anything. Governor Jay Inslee announced the launch of a statewide contact tracing plan today. That was May the 12th. That will allow more businesses to open. Right, we'll let you open up if you cooperate with our um, dictatorial demands. And more people to be active in public while helping to slow and prevent the spread of COVID-19. Why do we need to slow and prevent the spread of COVID-19? Didn't it already spread? Didn't we already flatten the curve? How do we know we don't already have herd immunity? Um, isn't it far less deadly than was originally thought? No, they're still continuing with the narrative that COVID-19 is deadly, and so therefore endless uh, oppressive measures are warranted. Quote, contact tracing is another tool in our toolbox for tackling COVID-19 in Washington. We always have to use these euphemisms, right? A tool in our toolbox for tackling. Oh, we need to continue physical distancing, right? The measures until now, they have to continue, right? So you have to function in society while constantly uh, avoiding coming near anyone, which is just impossible. So therefore, all it means is constant trauma and fear. And even with the masks, right? The masks you have to do, but they don't really help. Physical distancing you have to do, but doesn't really help. And therefore, I'm going to do more. You do contact tracing. Quote, this will allow us to get a better handle on who gets sick and how the virus is spread, which is vital to reopening our economy. Yeah, no, they don't just want it for, I don't know, keeping records. Local health departments will lead these efforts, and the State Department of Health and its partners will support this work. Right. All these health officials, these supposed expert doctors and professionals, they're all sold out. They're all cooperating with this insane fascist takeover of the world. It's just incredible deprivation of rights. They're all cooperating. They're all going along with it. Why? Because clearly they're being told to do so by superiors, and they don't want to lose their jobs, and that's it. Following orders. And here we have this image. They have to have an image to make things look scientific and just make it sort of seem legitimate, right? It's contact tracing across the top, and it has these arrows. You've got the COVID-19 supposed image of the virus in the middle with the ball with the spikes coming out to scare people. It looks like some kind of alien. All right, step one is confine upon first symptoms, right? Which means even though we can't prove that you have COVID-19. You could just have the regular flu, but anything that seems like COVID-19, we're going to force you to quarantine yourself, and then we're going to retroactively uh, find out who was in contact with you through your smartphone, and then assume that they also caught the disease from you and confine them, and then test widely, right? The more people test positive, more people can confine, and then each of those people have to stay home supposedly for 14 days. Yeah, sure. Those who test positive for COVID-19 need to confine at home until both at least 10 days have passed since the first symptoms and at least 72 hours have passed without a fever, without fever-reducing medication. Close contacts need to confine at home for 14 days after last exposure, right? So the government, this Gestapo, is going to be uh, tracking your movements, and you will be under house arrest for 14 days if they think you might possibly have COVID-19, even without a test, even though they claim they have tests. But that won't even be necessary as long as they have reason to think you might have any symptoms of COVID-19. Then that's ready enough to confine you. And then they've got to um, test people, healthy people, and then if they test positive, then confine them, even though they have no symptoms, simply because they tested positive. So either you have symptoms even without testing positive, then they can confine you, or the reverse. You have tested positive without symptoms. It's just like what they did with the death certificate, right? First, they told us that there are two ways they want to have the cake and eat it, right? They um, will record someone as having died from COVID-19 if they have any symptoms that might be COVID-19 without a test. But then, even if they don't have any symptoms of COVID-19, they'll make a point of um, using a test, of testing those people, testing them posthumously, and if they test positive, then they'll record that also as a COVID-19 death. So even if the person died from something completely different, since they tested positive, they'll record that as a COVID-19 death. So that way they can cover all their bases and jack up the numbers. That's the name of the game. So that's in terms of jacking up the death count so they can justify all these um, oppressive, restrictive measures. And now they want to jack up the number of people who they can deprive of their rights. Yes, the tests are complete bogus. They don't test for COVID-19 and they give false positives. A goat and a fruit tested positive in Tanzania, and they're just blatantly faulty. And yet, the official sources just continue denying that, just living in this alternate fantasy nightmare reality where these tests are real and therefore the results are real. And even though those results don't come anywhere close to a pandemic, still, we're going to continue with the testing and use those tests to oppress people. People should confine at home immediately upon first symptoms. People testing positive need to confine at home until at least 10 days have passed since first symptoms and at least 72 hours have passed without a fever. All right. and they see improvement in cough or shortness of breath, right? So you're going to have some busybody uh, preventing you from leaving your house, um, imprisoning you if you do, like coming down you really harshly if you do, even if, as far as you're concerned, I mean, you're not even sick. Um, quote, when someone tests positive for COVID-19, an interview will reach out by phone. Reach out. Oh, don't reach out. No, they're coming with the power of the state. They're not reaching out. They will ask who that person has been in close contact with and reach out to those other people to let them know they've been exposed. Well, who said they were infected? You know what? And if it's so contagious, then all these measures are pointless because it'll spread regardless, and it's already spread by now to the entire population if it's so contagious. If it's so contagious, you can assume that anyone who's come in near anyone who's been infected is also infected. Well, then, what point is there in all these mitigation measures? It's just so this is all it's beyond illogical. It's it, it's just mind-blowingly absurd. Close contacts need to confine themselves at home for 14 days after the exposure and monitor for fever, cough, and shortness of breath for the duration of confinement. The state encourages testing of all close contacts regardless of symptoms. Right. So the more people they can test, the more people will test positive, more people get false positive, then the more people, then those people too, in turn, can be interrogated about whom they came into contact with. Support is available for people who must confine at home. What does that mean? What kind of support is that? Um, were they, in a sense, government psychiatrists? Okay. The information collected is only used by public health professionals and is confidential. It will not be shared. Yeah, trust us. You can trust the government with your private information. You can trust them. They'll they only mean your best. These professional interviewers will ask about symptoms, recent exposure, and demographic questions such as age, address, gender, and ethnicity. Yeah. Data is only accessible to public health professionals. Yeah, sure. Will not be shared with anyone else. Yeah, sure. Contacts will not be told the name of the person who may have exposed them to COVID-19. So you have no way of contradicting an assertion that you were exposed to COVID-19 because you came into contact with someone, because they won't even tell you who that person was. It's like you're not entitled to face your accuser. The same kind of injustice. What nightmarish potential this holds for the state to just lock people up because they can claim someone came into contact with someone who had COVID-19 or who in turn came into contact with someone who had COVID-19, who knows how many times back, they can just lock you up for that. They can just take you and put you under house arrest or determine that you can't stay in your house. We'll get to that. Um, Unbelievable um, deprivation of rights. During the governor's press conference, he announced that the statewide contact tracing team will be trained and available as needed by the end of the week, May 15th. That's today. That's today, guys. Contact tracing is um, starting now. The contact tracers will include members of the Washington State National Guard, right? That's military. You got it? A military guy trained for violence will be coming around to your family and interrogating you and um, invading your privacy, coming in without a warrant, which is a violation of the Fourth Amendment. It's a violation of any civil society. It's just and and there's nothing you can do. And if you don't cooperate, well, then they'll take you to this undisclosed location, these special places. Clearly, we're heading in FEMA camp direction. The contact tracers will include members, right, of the National Guard. The State Department of Health plans to continue training more workers and volunteers to replace them over time, right? Yeah, the Department of Health. So yeah, health workers, huh? Health workers, right? The frontliners sacrificing their lives for the sake of the people, worship the doctors and the nurses, bow to them. You have literally images of people bowing to doctors and nurses, and like paintings and cartoon images of that. The worldwide worship doctors and nurses cult, religion, all of course sponsored by, supported by this unholy alliance between the deep state and big pharma, um, to control people through fear of disease, all based on the argument from the authority of the doctors and this claim that, what we hear from nurses is true, so that we can use nurses as crisis actresses and actors. And in general, if you review nurses, the more we review nurses, the more we um, trust the narrative of, that there are these vast numbers of people falling like flies in hospitals because nurses say so, and some nurse comes crying. It could, maybe something did happen in that hospital. That nurse, it doesn't change the fact that that nurse is uh, is being used to justify this evil narrative for control and power and domination. All right. So so by the end of the week, we will have 1,371 contact tracers trained and ready. He called them an army. This Inslee, he called them an army. He called contact tracing a weapon. Well, I think that language was very accurate. This is a invasion of our privacy, of our society, of our complete um, robbing of our civil liberties. Quote, at the sign of any symptoms, right? Could be a whole host of other things, but no, if there are any symptoms, you have to assume that you have the dreaded COVID-19, and therefore obey everything we say, or else. Quote, people should confine themselves at home. Voluntary confinement for both ill persons and the members of their household will be a major challenge. It is one of the most critical portions of this entire endeavor. And individuals and their households will need to be confined for 14 days if they're exposed to the virus. We know this will present challenges to some families, and we are looking at ways to address them. Well, who would it not present challenges for? What kind of nonsense is that? It essentially means that if one person is deemed to be possibly carrying the disease, then the entire household has to be prevented from going outside at all. Um, Anyone would have to be a complete moron to um, in any way enable any of this. An interview will call those who test positive for COVID-19. They will work to identify and inform close contacts of potential exposure. Close contacts should confine home for 14 days after exposure. All right. Community health volunteers help public health officials with customer care service, data gathering and entry analysis, language skills, and much more. Volunteer assignments may vary in scope, location, time, and length of commitment. Right, so community health volunteers. So basically, people are officially volunteering to help with this, but they will be paid. I read that elsewhere. They will be paid. The current healthcare license or medical background is not required to volunteer. The only thing required to volunteer is to be a sellout, to lack morals, to be willing to do anything for money. That is what you need to volunteer to be a contact tracer. Yeah. Right. We will have attached to the families from Jay Inslee. A family support person will check in with them to see what they need on a daily basis and help them. If they can't get a friend to do their grocery shopping, we will help get them groceries in some fashion. If they need pharmaceuticals to be picked up, we'll make sure they get the pharmaceuticals. They're going to help encourage them to maintain their isolation too. Right. Oh, so nice that you're getting people to help. That's so selfless and kind. Um, yeah, so the question was, when it comes to contact tracing, how are you guys going to handle people or families who want to refuse to test or to self-isolate? If they want to leave their home to get groceries, I know you've said they can't do that. How do you make sure they don't? Right? These are the key issues. So answer. As far as refusal, it just shouldn't come to that. And it really hasn't, right? Yeah. How dare you consider disobeying us, all-knowing experts, uh, wanting to exercise your freedom? We've had really good success when we ask people to isolate. They've done so in really high percentages, so we're happy about that. We believe that will continue. Right, that's a veiled threat, Now, what we don't see here is discussion of the fact that um, they have a plan to separate people who they deem should not be allowed to isolate at home and put them in detention centers. And this will include separating children from their parents. And they've already designated places for youth and child um, centers or supervision centers to youth and children quarantine centers in government in Washington state, and the other states will follow this example. This is not about one state. This is just going to be rolled out and is being rolled out throughout the entire country. So let's look at some of these comments here on this article. Comments are very often very insightful. If these assaults on your dignity do not justify a deadly force response, what does? If you will not resist this, what will you resist? Yeah. I can't leave my house. and I'm to be interrogated and to be forced to take a test if I don't want to take this. Why should I have to take a test? What? How dare you? That's a violation of the Fourth Amendment against warrantless search. Also, I didn't mention this. Um, they can force you to take a test. Um, because, right, sorry, I did mention this. Someone can tell the contact tracer, right? John can tell the contact tracer that he came in contact with Jim, and Jim doesn't get to know who is accusing him, or reporting him as having come into contact with someone who might have had COVID-19. He doesn't get to know that. So anyone could inform on anyone else, right? Unbelievable. It's the same as with um, CPS and things like that, that the government will come and, based on a report that can't be, um, like you can't face your accuser, but um, uh, the potential for abuse of this, and I mean, the clear fact that this is outrageously uh, abusive, tyrannical. Best approach is to refuse testing. When they force you to stay in your home, get word out via your computer. There will likely be websites devoted to interviewing people who are basically under house arrest. House arrest. Right. No one should comply with these tests. These tests get false positives, so you should not comply. Um, you shouldn't comply. I mean, what will that mean? I don't know. I don't know what it will mean not to comply. Will the contact tracers come in with guns? Or will they call the police on you if you don't comply? I think that's likely. What can we do about this? No. They've engineered everyone to sit around in their homes staring at their soon-to-be 5G computer screens. Realize they can shut them off whenever they want and blame China, Iran, whoever, and start their World War III. All right. It's time to do what our forefathers said in the preamble of the Declaration of Independence. What Mr. Inslee is doing is unconstitutional. This pandemic is being used against the governed. This quote virus unquote is about money and power. Look at who stands to benefit the most. Too many nurses and doctors have posted videos that have gone viral. They state in some hospitals patients are being neglected and killed for things not related to quote unquote corona. But on the death certificate, they write COVID 19 in order to increase the stats and pad certain entities' pocketbooks. It's time to act. The people of this state do not yield their sovereignties to the agencies that serve them. The people in delegating authority do not give their public servants the right to decide what is good for the people to know and what is not good for them to know. The people insist on remaining informed so that they may maintain control over the instruments they've created. Right. This is, and it's from some law. All right. Next comment. This sums it all up. Trust the government. They would never lie to us. We must trust Bill Gates with our lives. We must trust the vaccine. Yep. Trust. Absolute trust. No matter how many rights you're deprived of, trust them. Steps are being taken to recall Inslee because of this. This petition at change.org is getting signatures every minute. Okay, impeach, recall Washington State Governor Jay Inslee. I don't see, I don't see why that would accomplish anything, but maybe, hopefully. Statement. The founding fathers did not attempt to quote unquote recall King George III or his armed goons. Just saying. Yes, they didn't mess around when they were deprived of their rights. So we want to be real Americans. What would be the lesson from that? Comment on the petition. The petition is poorly written and does not cover how Inslee's contact tracing and forced quarantines are unconstitutional. Inslee is getting a big handout from Bill Gates, who appears to be the real dictator for Washington state at this point. There's a blatant conflict of interest between Bill Gates, the big vaccine uh, tycoon who stands to make trillions from a mandated vaccine. That is his endgame. And Inslee is getting big bucks from Bill Gates. Well, we can't be surprised. Bill Gates and his cabal have planned this event, this plandemic, scamdemic, in incredible detail for years. They planned it who knows how long ago. People say 9/11 was planned 30 years before. No doubt that this event had been planned. It was a very long time in the planning. But, you know, just a few weeks ago, we saw how a movie from the 2000s was a TV series from the 2000s um, accurately quite predicted was predictive programming uh, for this event. It had China, an epidemic starting in China and then spreading, becoming a pandemic, and it had hydroxychloroquine as the solution. It was really eerie to watch. I didn't watch the whole movie. I watched, short clips from it. So believe that this has been planned out in great detail. All of these things are not just happening because the government decided. No, all these people are getting scripts, and they're getting um, uh, planned, uh, carefully, long prepared statements to make and laws to pass, and every single event that happened was according to a phased program. Have no doubt about that, guys. All right. Yeah, so this petition is too mild. Strange how the first people who got sick were from Washington State, and all of them were in nursing homes, and then the cruise ships where more elderly can be found. Um, if anyone can finger you as a contact, which has the potential to bind you under criminal prosecution, right? Because if you refuse to submit to a test or submit to quarantine, you become a criminal. So simply by being designated as a contact, as having possibly been infected because you were supposedly exposed, then you are now essentially presumed the equivalent of a presumed criminal. Without you knowing who that person is, you are literally building a situation where citizens are more likely to be suspicious and not comply. Don't do this. Right. Yeah. Yeah. If they would be genuine in their measures, they would not set up a situation where there is intense suspicion and fear related to reporting, would they? Um, so therefore, clearly, um, that's further proof that this is all not at all what they claim it to be. Statement: if you want this to work, transparency is necessary. People must know that the government they've elected is working for and not against them. You want participation, educate and help people to understand how to best protect themselves and their family. Um, right. Putting citizens on lists and threatening them with criminal prosecution is what a state would do who can't think harder and smarter than some ape dictator. Do better, be better. Well, that guy's very generous. He's assuming that the government means well. It's just going about it the wrong way. Um, yes, even according to that perspective, that mistaken perspective, this approach is completely wrong because it creates a climate of fear. Well, I would say it's not wrong at all. They want to create a climate of fear. That is their agenda, and therefore, this is quite effective measure to promote their agenda. So I don't fault them on using these methods. I mean, I think they're quite effective for the goals that they have, which is to expand the police state and the mind control and the fear, uh, including fear of other people informing on them. Statement: they can tell anyone they want someone fingered them when nobody did. You think they won't just lock up anyone who they don't want talking? Right. The state now has a pretext. Like I said, the state has a pretext to just lock up anyone. They can say they got an anonymous report that this person had was a contact. Then that person refused to cooperate, and therefore they locked him up. For everyone's good. That's it. Who will? It's impossible to contradict. It's not. It's not falsifiable. This claim. So therefore, it's a recipe for tyranny. Statement: welcome to 1984. Big Brother's being deployed. Fingermen are being recruited and trained. It's all under the friendly euphemism called contact tracing. Wake up, people. Statement, May 13th. Apparently, there's an anti-Inslee rally tomorrow evening at the Capitol. We can't let them do this. Our sheriffs are not going to help us. We have to mobilize, right? Almost everyone who's in an official position is compromised and is cooperating, is afraid to speak out, or is being essentially bribed. Um, yeah, the citizens, the average person is essentially alone. Only very few officials, people with power, are really standing up for the rights of the people today. Saying the domestic enemies are here and are recruiting soldiers into their armies, right? The enemy is not in some other country. The enemy is this Inslee. This Inslee is recruiting what he calls an army with what he calls an enemy against the people. If you can't see how this is a full attack on the freedoms and constitutional rights of Americans, then you did not learn what it means to be an American. The time to fight back is now or be a slave from here on out, right? Just imagine all those people who will zone out any criticism of the government, no matter what happens. And they'll have a much bigger shock once the measures become really severe and affect them personally. We're talking about here an agenda to separate children from parents, to destroy the family unit, to uh, create fear within the home. Beforehand, the lockdowns created fear outside the home, but in your home, you are safe. Now, they want to encroach upon the private, personal, until now, mostly protected territory of your home. Now you're not safe in your home. Where can you go? I don't know. I just started off with that question. I don't know where you can go. I don't have any solution. Statement. I have no doubt that those who are quote unquote undesirable, for example, capital T, capital C, thought criminals, will quote test positive for COVID-19 and then be forcibly quarantined somewhere other than their home. Right. This is police state. This is just complete police state. That is, unless they resist by any means necessary. Folks that go quietly will either return quote unquote cured of their errors or they will sadly succumb to COVID 19. Yes. So they'll be essentially going, apparently, to some kind of a re-education camp. Re-education. Got to be re-educated. If you think that you should, if you object to being tested or you object to something, this is the direction they're heading. Re-education camps. And yeah, if you're taken out of the home by force because you refuse to submit to a test or whatever pretext they had for separating you from and essentially imprisoning you, if you die, no one will know how you died. They will be able to say, oh, we separated him because he had COVID 19 and then he died of COVID 19. Statement, no, thank you, will not comply. Time to stand our ground and fight against the government. Stay at home and not leave? How about lock up the governor at home and not let him leave for, say, 30 years? So essentially, if you deny a test, you will be assumed to have COVID 19 because you denied the test, so they will assume that you do have it, they will confine you to your house. Let's see that article. This was from 2 days ago. Yeah, the heading is, if we do not succeed in this second stage of our efforts, this virus could come right back and bite us, right? Always threatening us. If you don't listen to us, ooh, the big boogeyman, the virus will come back. Some more people could die. Death, death. Listen to us or else death. We know how to prevent the death. You can trust us. Our measures they're difficult, but they're necessary because we said so. Um, anyway, um, getting groceries. Ainsley said the initiative is reliable, energetic, and comprehensive, and all three are necessary for success. Right? He's using these positive, like feel-good words to describe the most outrageous invasion of tyranny um, that I don't know, maybe that America has ever known. Quote, if we do not succeed in the second phase of our efforts, this virus could come back and bite us. All right. What if Washington residents do not obey? How about execution? The answer is as scary as many worry. According to uh, Hutwin, for those businesses and individuals who do not comply, the governor stated that he confirmed with Attorney General Bob Ferguson there will be sanctions in a civil or criminal court. If you do not submit to a test, you will be treated as a criminal, you will be fined, imprisoned, you will become a criminal simply for refusing a test without any proof that you even came into contact with someone who supposedly had COVID-19, who themselves never even necessarily took a test. Those who refuse to cooperate with contact tracing specialists and refuse to test are not allowed to leave their homes to buy basic necessities. The question is, of course, is that how much time will pass before this, quote, mandatory testing is resumed before the mandatory vaccination? Right. So that's what this is all preparing for. This is the plan. Get people to submit to forced testing, and that way you can jack up the numbers of COVID-19, jack up the fear, jack up the government control, um, increase the penalties, scare people into compliance, and a later phase, the next phase right after this, but certainly a phase coming up will be mandatory vaccines, and anyone who does not comply with the vaccine will be treated like a criminal. Will be fined, will be likely imprisoned. If you don't comply with the vaccine, you will be viewed as endangering everyone else because we need everyone to take the vaccine because of herd immunity, right? We can't say herd immunity means that the disease, which is supposedly so contagious, spread already, and therefore everyone's fine because we already have herd immunity. No, herd immunity is only a valid concept in the context of forcing people at gunpoint to threat of uh, criminal status of taking the vaccine. That's when suddenly then herd immunity becomes a thing. It becomes the all you know the perfectly legitimate justification for gross violations of people's rights and freedoms because there always is some pretext, some legitimate sounding, official sounding pretext which allows people's rights to be um, robbed from them. I don't know. We really need God to help us. This is outrageous. This is the new world order, the police state, uh, you know, opening before our very eyes into reality, and we really need a miracle. God bless. Thanks for listening. Please like, share, and subscribe to my channel.